AndroPauseSpecialist.com. Symptoms of andropause. Low energy. Testosterone plays an important role in energy production. You might be feeling less energetic when it comes to work or everyday activities. Efficiency may be reduced along with your sense of achievement. This is a common symptom of andropause. Your fatigue may be physical or mental, and while fatigue is the way the body reacts to physical exertion or stress, it could be a sign of a physical disorder. Physical fatigue. If you have physical fatigue or muscle weakness, this means your muscles aren't able to exert the expected force given your general physical fitness. Mental fatigue. You would notice this as somnolence, decreased wakefulness, or just a general decrease of attention, not necessarily including sleepiness. Fatigue is a normal result of working, mental stress, overstimulation and understimulation, jet lag or active recreation, depression and also boredom, disease, and lack of sleep. But physical and/or mental fatigue can also be caused by low hormone levels. If you're experiencing either of these conditions, it's important to have your hormone levels checked because it may be a sign of low testosterone. Depression and andropause. With depression, you may feel as if you're in a low mood or don't want to engage in activities. This can affect a person's thoughts, behavior, feelings, and physical well-being. It may include feelings of sadness, anxiety, emptiness, hopelessness, worthlessness, guilt, irritability, or restlessness. Depressed people may lose interest in activities that once were pleasurable or suffer cognitive impairments like difficulty concentrating, remembering details, or making decisions. They may contemplate or attempt suicide. Their weight may change dramatically. Insomnia, excessive sleeping, change in sleep patterns, for example, waking in the middle of the night or early in the morning and being unable to fall asleep again, fatigue, loss of energy, and aches, pains, or digestive problems that are resistant to treatment may be present. Depressed mood is a normal reaction to certain life events, a symptom of many medical conditions, and a feature of certain psychiatric syndromes. Depression may be a marker for low testosterone in men. Andropause can show up as irritability or depressed behavior, and this can be emotionally draining. There are many treatments for depression. However, depleted testosterone should be treated differently than other forms of depression, which may require a psychiatric evaluation and psychopharmacological medications. A major symptom of low testosterone is depression. Depression is typically defined as a 2-week period or longer marked by various symptoms. They represent a change from previous functioning. At least one of the symptoms is either a depressed mood or a loss of interest or pleasure. Symptoms are 1. Depressed mood most of the day, nearly every day, as indicated by either subjective report, for example, feels sad or empty, or observation made by others, for example, appears tearful. 2. Markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day, as indicated by either subjective account or observation made by others. 3. Significant weight loss when not dieting or weight gain, for example, a change of more than 5% of body weight in a month, or decrease or increase in appetite nearly every day. 4. Insomnia or hypersomnia nearly every day. 5. Psychomotor agitation. 6. Fatigue or loss of energy nearly every day. 7. Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional, nearly every day, not merely self-reproach or guilt about being sick. 8. Diminished ability to think or concentrate or indecisiveness nearly every day, either by subjective account or as observed by others. 9. Recurrent thoughts of death, not just fear of dying, recurrent suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing suicide. Sleep difficulties and andropause. If you have andropause and low testosterone levels, this could cause insomnia or sleep apnea, both of which contribute to fatigue. Basically, insomnia is defined as a person who has sleep difficulties. Usually, a positive response to either of these two questions provides the clue. Do you experience difficulty sleeping? Or, do you have difficulty falling or staying asleep? Insomnia can be both a sign and a symptom of several sleep, medical, and psychiatric disorders characterized by persistent difficulty falling asleep and/or staying asleep, or sleep of poor quality. People with insomnia generally don't function well while awake. One definition of insomnia is difficulties initiating and/or maintaining sleep, or non-restorative sleep associated with impairments of daytime functioning or marked distress for more than 1 month. Sleep apnea. This is a condition where you have abnormal pauses in breathing or periods of abnormally low breathing while you sleep. Each pause in breathing, called an apnea, can last from a few seconds to minutes and may occur 5 to 30 times or more an hour. Sleep apnea can be easily diagnosed with a polysomnogram. People who have sleep apnea are rarely aware that they have this condition even when they awake. It takes someone else to notice the person's difficulty in breathing, or apnea is suspected because of its effects on the body. Sometimes these symptoms can go on for many years without being identified. During this time, the person suffering from it may become conditioned to daytime sleepiness and fatigue caused by the sleep disturbance. It is extremely important to identify what is the cause of the sleep disturbance so it can be treated accordingly. Andropause symptoms. Loss of bone mass. Osteoporosis is a disease of bones that leads to an increased risk of fracture. With osteoporosis, bone mineral density is reduced, bone microarchitecture is deteriorating, and the amount and variety of proteins in bone is altered. Osteoporosis may arise at any age and affects men and women equally. This form of osteoporosis results from chronic predisposing medical problems or disease, low testosterone, or prolonged use of medications. Osteoporosis risks can be reduced with lifestyle changes and sometimes medication. In people with osteoporosis, treatment may involve both. Lifestyle change includes diet and exercise and preventing falls. Fall prevention advice includes exercise to tone deambulatory muscles, proprioception improvement exercises. Equilibrium therapies may be included. Exercise with its anabolic effect may at the same time stop or reverse osteoporosis. Loss of muscle mass. Declining levels of testosterone can lead to a loss of muscle mass.